My name is Olivia Rattray. I'm a student at Athabasca taking my master's in nursing. Today I'm talking about The Theory of Human Caring by Gene Watson, developed in 1979. The theory ultimately encourages nurses to see their practice differently rather than just focusing on tasks and procedures. It emphasizes the meaningful moments that occur between nurses and other human beings. At its core, the key theoretical concepts develop a theory that fosters authentic connection. It embraces a philosophy of loving kindness and compassionate care. Nurses help patients feel seen, heard, and valued, promoting healing and well being. Importantly, also, it addresses self care, as nurses who neglect their own well being may struggle to provide effective and compassionate care to others. A key contribution of the theory is it provides the language to define the nursing profession, making nursing distinct from other healthcare roles. It fully describes what nursing is beyond science and tasks, highlights the relational, human, and holistic aspects of care by naming and defining these caring moments. Watson helps make the often invisible work of nursing visible and recognizable. The Caritas process was a tool that she developed that involves 10 steps. Many hospitals are implementing this to guide practice today. Nurses first recognize when an interaction or caring moment occurs between the human and nurse, reflect on the moment, and then out of the 10 processes, apply which one is most relevant to the interaction that occurred. This allows to deepen the connection and promote healing. This also contributes to advancing the nursing profession as a whole and contributing to nursing knowledge. Her theory assumes that caring is essential to nursing and that authentic connections between nurses and patients can promote healing and wholeness. A major strength of Watson's theory is it provides nurses with both the language and a systematic framework to support holistic care and healing environments. A limitation is that it does not fully address high acuity or emergency situations, where nurses may not have time to pause, reflect, and intentionally apply the Caritas process. A case study we are using to apply this process is a 28-year-old second-time mom who presented to the unit anxious and hesitant, had limited prenatal care, an abnormal fetal heart rate tracing, and later disclosed a history of sexual assault. I wonder if I approach this patient in a way that truly supports a healing environment. I think Gene Watson could help me.
Hi, Olivia. Thank you for reaching out. I love to help other nurses on their caring healing journey.
Thank you for meeting with me, Jean. Did you get my email about the case I've been self-reflecting on? I am trying to understand if I provided a caring environment to this patient.
In such a situation, you must be fully present, which is what I refer to as authentic presence. Listen deeply and respond to her emotional cues. Even while performing clinical interventions, you can show care through presence, reassurance, and gentle communication. Transpersonal caring allows the patient to feel safe, understood, and respected, which supports both her emotional well-being and clinical outcomes.
Okay, so when I noticed her tension and fear before the exam, I practiced authentic presence by pausing and explaining each step and giving her control of the situation by gently reassuring her. That presence helped create a transpersonal, caring moment where she truly felt seen, respected, and heard.
Exactly.
Okay, so which aspects of your 10 Caritas processes should I focus on when a patient demonstrates fear or reluctance due to past trauma?
In a situation like this, the most relevant Caritas processes are clear. You must practice trust or transpersonal presence by truly connecting with the patient and being fully present. You hold a forgiving space, allowing her to express any negative emotions that arise without judgment. And you co-create a healing environment, shaping the physical, emotional, and relational space so she feels safe, supported, and respected. These are the actions that help care become truly transformative.
Okay, so when I offered to stop the examination, this was me building trust with the patient, also known as transpersonal presence. And by asking everyone to leave the room, this was me co creating a healing environment which allowed for a forgiving space for her to feel safe to express any negative emotions.
Yes, it sounds like you did a great job providing a caring and healing environment for this patient.
Thank you. How can I maintain authentic patient centered care when urgent clinical needs demand quick action during labor?
Caring is about intention. Even in urgent circumstances, your presence, tone, and explanations matter. Mindful, empathetic interaction does not slow care, it enhances it. Technical skill and relational presence work hand in hand. By attending to the human experience of the patient, nurses promote healing within the shared unitary field created through the nurse-patient relationship.
Okay, I understand. Because nursing is both a science and an art, we rely on both our clinical skills and our authentic presence, even in emergencies. The intention we bring through our tone, explanations, and communication still matters. By briefly explaining what is happening and remaining calm and present, we continue to build trust with the patient while providing the urgent care they need. In doing so, we foster connection within the shared unitary field of the nurse to patient relationship. In this case, the husband wanted to proceed with the vaginal exam out of fear. How can your theory guide my interactions in these situations?
The patient's voice must remain central. Caring involves advocating for the patient while facilitating dialogue and understanding with family members. Empathy, relational skills, and communication ensure that the patient's dignity and autonomy are respected, even when others are involved in decision-making.
Okay, so as her nurse, I need to respect and advocate for what is best for her because it is her body and her experience. My role is to support her autonomy while communicating respectfully with the husband so that her voice remains central in the decision making process. Providing transpersonal care can be emotionally demanding. How do nurses maintain their own well being while practicing your theory, especially complex trauma informed care?
Self-care is essential. Reflection, mindfulness, and peer support help you remain present and compassionate. Only when the nurse cares for themselves can they authentically care for others. Caring for yourself ensures that every interaction with the patient remains meaningful, respectful, and healing.
Wow, thank you for all your help today. Our discussion really influenced how I think about my nursing practice, and it reinforced the importance of providing holistic and patient centered care. It reminded me to continue fostering compassion, empathy, and trust within nursing relationships while supporting trauma informed and relational nursing practice. Ultimately, Watson's theory reminds us that compassionate human connection is at the heart of healing and nursing.